Hey, Mike and Alex here. We're talking about sitting. Right now we're going to talk about posterior hip mobility and how that can really contribute to low back pain from sitting. Take it away, Alex.
All right, so we talked a little bit about setting your pelvis in a nice stable support for your back. Bring that camera over again. So step number one is getting this pelvis tucked under you. A lot of people have a hard time doing this. It lengthens your posterior fascia a little bit, which is good. But let's work on how to mobilize this butt tissue here. One way you can do it's what's called a sitting piriformis stretch. We've seen lots of versions of this.
We like to call it a figure four stretch.
So let's get into it right now. So bring that right leg up. And
This is legit, by the way. I'm not faking.
Yeah, Mike's pretty stiff getting into there, and you see that once he gets in there, he almost bails out of it a little bit. Scoot back in the back of the chair a little bit more if you can. That'll help you out a little bit, nice and tall.
I'm not very flexible.
And so that's about his end range. He can't really get more. If we like to dip forward a little bit, but if you're getting into this position and you're already feeling the stretch, that's perfect. That's all you need to do. Let me hop in there. And so same issue across all kind of spectrums. So I can get in here and I can get in there a little bit better. And if you can get here successfully without pain, if you're feeling a stretch, you can add a little bit of a forward lean. I'm not bailing out through my low back.
Look at how straight his spine is
You
compared to
gotta
mine.
keep it nice and tall, and I'm getting a good tissue length here. And then let's go forward so you can hit all fibers of your posterior hip. And then you'll go the opposite way towards your ankle. So you're hitting in 3 different positions to start off with. And this is a good way to keep your back less sore and achy throughout the day.
And you can do it while you're still sitting. Thanks a lot.